We've identified a new asbestos-related disease, and we're figuring out ways to avoid it.
Her story lives on in each and every one of you.
Firefighters that have lost their lives, that have really put everything on the line.
Good afternoon. My name is Domani Tripam, and I am so excited to be a part of ADAO's 11th Annual International Asbestos Awareness Conference. I am truly humbled to be included amongst such impressive speakers. Thank you, Linda and ADAO, for this opportunity. It is wonderful to be able to connect with such an amazing group of attendees and participants, including so many incredible experts and inspiring individuals that have been affected by asbestos-related diseases. Today, I want to talk about prevention and what my family and I are doing about it. First, let me tell you a little about me and how I got involved with ADAO. I do not have a degree or a professional background relating to asbestos or mesothelioma. In fact, all I know about asbestos and mesothelioma, I learned the hard way, like too many of you here today. I learned by personal experience. I grew up on the southwest side of Chicago as one of 9 children, the daughter of a hero. I know that every daughter thinks of her dad as a hero, but mine truly is. He served as a Chicago policeman for 28 years and then spent another 15 years working for the Cook County Sheriff. And throughout that entire time, he often worked 2 or 3 jobs in order to provide for his family. Yet he always found time to have fun with all of us. In 2011, my father was diagnosed with mesothelioma. As I'm sure all of you have heard way too many times, my family and I were completely unprepared for this diagnosis. We all had heard about the commercials on TV, but we really didn't understand what mesothelioma was, how our dad was exposed, or what his options were now that he was diagnosed. And we certainly never expected to hear from my dad's doctors that he only had about 4 months to live. He was in retirement and should be enjoying time with his family and friends, enjoying life to the fullest. Instead, he was given a death sentence. What we did know is that we, nor our dad, were going to take this sitting down. We were ready to fight. Thinking we only had a few months left with our dad, we had planned to have family photos taken. We then received the amazing news that my dad was cleared to have a radical pleurectomy at the University of Chicago. It was quickly scheduled for the week after our photo shoot. A couple of days prior to our family photos, our dad jokingly mentioned that all he needed for his surgery was his cape, and he would be fine. One of my sisters brought a cape along to the photo shoot, and that's when my dad went from a hero to a superhero, and Super Dad was born. As you can imagine, we were all scrambling to learn as much as we could about mesothelioma so that we could help our dad. While researching, I ran across an organization called Immerman's Angels. They are a wonderful organization that connects individuals that have been diagnosed with cancer and their families with cancer survivors and their families. They try their best to match you with someone facing the same type of cancer. I was so fortunate that they connected me to Janelle Beadle. In Janelle's initial email to me, she wrote, "I'm here for you. Whatever you want to talk about or any questions you have. I am very involved with other meso patients. If you are on Facebook, I can send requests to you if you would like. It really helps me be in a meso community. I will be here waiting for your response." When I learned Janelle's nickname was Wonder Woman, I knew she was extra special, another superhero fighting this horrible disease. She became my hope and inspiration. She also did as she promised and connected me to many individuals on Facebook, including Linda and ADAO. And what an amazing group of individuals I have gotten to know because of her. After our super dad recovered from his surgery, we had the opportunity to meet with the mesothelioma specialists at University of Chicago. We learned a lot about asbestos exposure and mesothelioma that day and decided then and there that we could and should help others. We knew that we not only needed to help University of Chicago and other mesothelioma specialists raise funds for research, but we absolutely needed to help raise awareness of this disease. Raising awareness was critical in order to raise more funds and to help those with mesothelioma understand that they didn't have to accept a death sentence. There were options. However, even more critical, we needed to help individuals understand their risks of exposure and how they could protect themselves and their families from ever having to face this horrible, completely preventable disease. A few months later, we started Mesothelioma Heroes Foundation, dedicated to raising awareness of asbestos exposure, helping those affected by mesothelioma, and raising funds for medical research. As part of our mission, last September, we held our first I Know a Superhero Family Fun Festival and softball tournament, an awareness and fundraising event. We are currently planning our second annual I Know a Superhero event. It will be held on Saturday, August 22nd on the southwest side of Chicago. I'm very excited to announce the proceeds from our 2015 event will support both University of Chicago Medicine's mesothelioma program and the Asbestos Disease Awareness Organization. I Know a Superhero is a family fun festival and softball tournament that includes entertainment for adults and children alike. Last year we had a softball tournament, beanbag tournament, 4 bands, a live reptile display, bouncy houses, magic, balloon art, face painting, caricatures, a dunk tank, superhero costume contest, a superhero artwork contest, a police canine unit demonstration, mounted police, raffles, and more. We had almost 500 people attend our first event, and this year we hope to double that number. But more important than all of the fun, we had the opportunity to spread awareness of asbestos exposure and mesothelioma to a neighborhood that is at high risk. At this year's event, we plan to double up our efforts on spreading much-needed awareness of asbestos exposure. You see, the neighborhood where we hold our event is the neighborhood we grew up in. It is also a neighborhood that is home to a significant number of people who are at a higher risk of asbestos exposure. My family and I know this neighborhood well. It is where we grew up, where some of us live today, and where many of our friends and relatives live as well. However, even as well as we know this neighborhood, after looking at some data, we were still shocked. Using information from the U.S. Census Bureau, I pulled statistics for the occupations that are most at risk, including education, training, and library, which mainly includes teachers, protective service occupations consisting of firemen and policemen, building and grounds cleaning and maintenance, construction and extraction, including all of the construction trades, installation, maintenance, and repair, which includes mechanics as well as heating and air installers, production occupations, which includes various assemblers and fabricators. Looking at the overall U.S. population, 27% of the employed population in the U.S., 16 years of age and older, work in these high-risk occupations. In Illinois, my home state, 26% hold these jobs. In Metro Chicago, that number is 25%. Those statistics are very consistent. Approximately 25% of our population is at higher risk of asbestos exposure based on their occupation. To me, that is a staggering number. But what about the neighborhood I grew up in? In that area alone, 39% of the population falls into these high-risk occupations. And I thought 25% was a lot. You would think that is enough to motivate us to educate this neighborhood, but there's more. In the U.S., the percentage of homes built before 1980 is 57%. In Illinois, it's 69%, and in Metro Chicago, it's 68%. However, in our neighborhood, it's a staggering 92%. 92% of the homes built in this neighborhood were built before 1980. The people living in these homes are our family, our friends, and our neighbors. Given these numbers, we absolutely need to educate them about their risk of asbestos exposure in their homes and on their jobs. And what better way to do that, to get their attention, than inviting them to join us for a family fun event. I wish someone had educated us so many years ago, before my super dad was exposed to asbestos. We can't change that, but we can give others that chance. If we are able to prevent one family from having to face what our family has, we will have made a difference. We are determined to do this. My challenge to all of you is to do the same in your neighborhoods. Through our united efforts, we can create change and save lives. Thank you all for your time, and thank you, Linda, and all of the ADAO volunteers that were... Sorry, one more thing. Thank you ADAO and all the volunteers that work so hard for all of us every day. My family and I are grateful for all of your efforts. Most importantly, thank you, Daddy, for being such an inspiration to not only to our family, but to so many others. You truly are a superhero, and I love you too much.